Good afternoon and welcome. May is Mental Health Month, as many of you know, and this is really an opportunity for all of us to come together and talk about mental illness, mental health disorders, and really work together to reduce the stigma around mental illness and connect people to the needed services. So we're delighted to present to you a series of Lunch and Learn seminars during the month of May. We hope that you are able to join us in person and virtually, and again, this opportunity to talk about various topics throughout the month of May. Last week, we focused on children's mental health, and we had a great children's mental health seminar on Friday, and really bringing together a variety of experts talking about trauma, ADHD, and the importance of starting early. That really is our theme this year, is how do we prevent mental health disorders? How do we prevent the severity? How do we prevent and mitigate some of the negative consequences associated with mental illness? So again, I'm Dr. Almeida. I'm the Director of Behavioral Health Services, and which is a department of Fort Bend County. We've been in existence for almost 12 years, and we're here to support the community, support the courts, our justice partners, and other county departments. Today, we have Dr. Todaro, who is a licensed psychologist. She actually a forensic psychologist with Behavioral Health Services, and has been with the department for over 7 years. And I think she's actually she's probably the oldest staff for, oh, no, Susan Sabelli, who runs our recovery reintegration program, I think has been here a little bit longer than Dr. Todaro. But I'm delighted to introduce Dr. Todaro. She's an expert in mental illness, competency evaluation, sanity evaluation. So again, really delighted to have her and for her to take time out of her very busy schedule to talk about mental illness. Thank you again for joining us. If you have questions, just put them in the chat. We have somebody monitoring the chat. And again, we hope that you'll join us throughout the month. Thank you.
Thank you, Dr. Almeida. Good afternoon. I'm Dr. Danielle Todaro. I'm a licensed psychologist with Fort Bend County Behavioral Health Services. I'm not sure if Dr. Almeida mentioned this at the beginning, but this webinar is going to be recorded. So hopefully we will be able to have it up on our website to access at a later date for folks to view. I'm going to be talking this afternoon about understanding serious mental illness. So doing a brief review of some serious mental health conditions that we see and I see in the work that I do, and also providing a little bit of information about resources and connecting individuals in the community to needed mental health services. Okay, so what are our objectives? So this afternoon, I'm going to be talking about what is serious mental illness. It will be abbreviated SMI. What are some of the symptoms of certain serious mental health conditions? I'm going to provide a little bit of information on mental health warrants, so connecting folks in crisis to services, finding treatment providers, and resources that are available in the community. So what is serious mental illness? So any mental health disorder gets classified as a mental health disorder when it leads to functional impairment in somebody's ability to kind of complete their day-to-day tasks. So you may have somebody that's experiencing some depression, maybe after the loss of one, so they're feeling sad or down, but they're still able to carry on their day-to-day tasks, go to work, care for their loved ones, things of that nature. If we have somebody, on the other hand, with a major depressive disorder, which we'll talk about in a few minutes, that's impacting their ability to get out of bed, to take care of their children, be there with their families, work, go to school, then that's going to be classified as a mental health disorder. So serious mental illness are those disorders that cause probably the most impairment in somebody's day-to-day functioning. They substantially interfere with an individual's ability to carry out their daily tasks. So today I'm going to be covering a few different disorders. So we're going to talk about psychotic disorders, which are probably the most significant serious mental illness that causes the most impairment. We're also going to talk about severe mood disorders like depression and bipolar disorder. I'll touch a little bit on the combination of psychotic disorders and mood disorders as they can kind of occur. I'll also talk a little bit about substance use and serious mental illness. And I'm also going to cover a few other diagnoses such as PTSD. That's not sometimes thought of as a serious mental illness per se, but a disorder that can cause a lot of impairment in somebody's ability to function on a daily basis. I'm also going to briefly cover developmental disorders, so intellectual disability and autism spectrum disorder. Again, these are not traditionally thought of as serious mental health conditions, but they are persistent conditions that can interfere in some individuals' ability to live independently on a day-to-day basis. So just a little bit of information about the prevalence of mental illness and serious mental illness, and keep in mind these numbers are from 2019. So about 50% of all lifetime mental illness begins by age 14 and 75% begins by age 24. And a lot of these disorders that I'm going to be talking about, especially some of the psychotic disorders, that early adulthood period, like 18 to 25, is often a time when we see the onset of a lot of these symptoms. Other disorders, we can see them begin at various points in an individual's lifespan, but this early period of development is when we tend to see a lot of symptoms emerge. So about 1 in 5 adults have experienced some type of mental illness in their lifetime. And of course, when we think about mental illness, depression and anxiety are the most commonly seen mental illnesses in the general population. When we think about serious mental illness, that's about 1 in 20 adults who will experience a serious mental health condition over the course of their lifetime. When we look at youth, about 1 in 6 youth ages 6 to 17 experience some type of mental health disorder. And kind of like what Dr. Almeida had talked about in terms of children's mental health, we tend to see different disorders in childhood, or maybe the very, very beginnings of more serious mental illnesses, but we tend not to see those symptoms really emerge until kind of late adolescence, early adulthood, like I mentioned. And then 3.8% of US adults experience a co-occurring disorder. So that's a mental health condition in addition to a substance use disorder. And in the seriously mentally ill population, we really tend to see a lot of co-occurring substance use happening. So I'm going to start with psychotic disorders. So as I mentioned, these are probably the most serious types of mental health conditions around. And basically, these are disorders, and you can see here on screen a list of particular diagnoses. These are all disorders where the person has some kind of impairment in their understanding of reality. So their perception of reality is altered. And we'll talk about the symptoms that kind of go along with a lot of these disorders. These individuals can have very disorganized thinking, very bizarre behavior, and experience a lot of symptoms, which again can interfere with their ability to function and live independently in some cases. Think about psychotic disorders in the field of mental health, we kind of break up symptoms into 2 very broad categories: positive symptoms and negative symptoms. So positive symptoms are symptoms that we see in somebody with a psychotic disorder that we wouldn't expect to see in a healthy, functioning individual. Whereas negative symptoms, which I'll talk about on the next slide, are things that we would tend to see in somebody who is functioning in a healthy way, and we don't see, or it's very limited or restricted in somebody with a psychotic disorder. So delusions and hallucinations are the 2 most commonly thought of positive symptoms when we're talking about psychotic disorders. So delusions are beliefs. They're very fixed beliefs, usually false, although sometimes there can be a little grain of truth embedded in some of these delusions, but they're fixed beliefs that to the person who has this disorder, they feel very real. And no matter how much evidence you show them to the contrary, will not kind of shake this belief that this is happening. And we can categorize the two bizarre delusions and non-bizarre delusions. So an example of a non-bizarre delusion, maybe somebody, and I've worked with plenty of individuals shared this. Maybe we have somebody that attended maybe 2 years of college, maybe they've graduated. However, they now have developed a delusion that they have multiple bachelor's degrees, master's degrees, they have a doctorate, a law degree, a medical degree, they've gone to Harvard and Stanford and Oxford. And so it's not something bizarre, right? Somebody can have these degrees, but it's clearly not based in reality. This person probably didn't get all of these degrees, even though they themselves truly believe that that is the case. So that would be an example of a non-bizarre delusion. And no matter how much evidence you show somebody that that's not true, that will not shake their beliefs. They will stay fixed in that idea that they have all of these degrees. A bizarre delusion would be a delusion, something that really is not plausible. So maybe somebody believing that their blood has somehow been poisoned, and in order to fix that, they need to drink household cleaners or bleach or something like that, and that will cleanse them of this poison in their blood. That's something bizarre. That's not really plausible. That's not really based in any kind of reality whatsoever. We also can break down delusions into various different categories and types. I won't go through all of them, but I'll touch on a few of the more common ones. So persecutory delusions, these are delusions when people believe somebody is out to get them, out to harm them. Somebody may think that the police are following them, that the FBI has bugged their phones in their home. Somebody is out to harm them. Grandiose delusions. We see this also in some mood disorders, which I'll talk about in a few minutes. These are beliefs that somebody has a very inflated sense of self-importance. So they may believe that they are a multimillionaire. They may believe that they are a celebrity, that they're the president of the United States, something that's very inflated, and they really think very highly of themselves. And then religious delusions. These are when people believe various different religious ideas. So they may believe that they are Jesus. They may believe that they are a prophet. They may believe that they are some other type of God or religious deity. And again, no matter how much evidence you show somebody, they will not really move from these ideas. They're very real to them. The other positive symptom that we see are hallucinations. So these are obviously perception-like experiences that somebody is having without an external stimulus. So the two most common hallucinations are visual hallucinations, where people are seeing things, and auditory hallucinations, where people are hearing things. And these things are not real. These things are not there. But to the individual who is experiencing those symptoms, they are very real. They are hearing things that, somebody else sitting in the room is not hearing. They can be very frightening because it's very difficult to discern what is actually happening and what may be something that only they are perceiving. They are not under voluntary control, so people cannot control if they're hearing voices or not. They may use tactics to try to drown them out or reduce them, but they can't control that. These are things that are happening out of their control. And there are various different types of hallucinations, like I mentioned, auditory, so hearing voices, hearing noises, or visual, seeing things are the two most common. People can also smell things or taste things or feel things that may not be there. So now the negative symptoms are things that we would see in somebody without a psychotic disorder that are missing or very limited or restricted in somebody with a psychotic disorder. So they may have very diminished emotional expression. Their face may look very flat. You may tell them that they won the lottery and there's no expression on their face. You may tell them that their grandmother passed away and there's no expression on their face. These other terms on here, they're kind of very clinical terms, but basically talk about avolition means very limited motivation to want to do anything. Alogia means very limited speech, so they may provide very brief responses, yes, no responses to question, not really produce a lot of speech. And hedonia is just a lack of energy, so very low energy, asocial, and want to be by themselves or withdraw on their own. In folks with psychotic disorders, we also see disorganized thinking and speech. And so we can infer that somebody has disorganized thinking by the way that they're speaking. So you may ask somebody a basic question, where do you live? And they may say, well, I live over in Rosenberg, and I went to at Terry, and I played on the basketball team, and my mom was on the PTA, but she went to work at McDonald's, and then my dad left, and then we ended up moving to South Carolina. So they may start out by giving you some information, but because their thinking is very disorganized or very loose, then they start trailing off and giving you information that has nothing to do with the topic at hand. They can't stay focused on what the question is. In very severe cases, we see something called word salad, which is a clinical term that we use to basically describe somebody who is not making any sense in their speech whatsoever. They're just stringing words together with no clear pattern or no clear organization whatsoever. So obviously we can have organic, naturally occurring psychotic disorders where it's a function of somebody's brain chemistry or family history in conjunction with trauma. It's nothing that the person has done and then they've developed a psychotic disorder. But we can also have substance-induced psychosis. So people can take substances, illicit drugs, sometimes medications, and they can experience some of these symptoms that I just described. So synthetic marijuana is a huge factor in that. Folks that use a lot of synthetic marijuana may then begin to experience hallucinations or delusions. Obviously, hallucinogens like PCP or LSD are going to induce hallucinations. Even some stimulants like cocaine or amphetamine, somebody can exhibit psychotic symptoms when taking those drugs. And the effects can be varied. We can have somebody with short term, so just while they're intoxicated and the drug is in their system, they exhibit these symptoms, and once they're sobered up, they're gone. We can have folks where maybe they've sobered up, but there's still some lingering effects and some lingering difficulties with delusions or hallucinations or disorganization. And then we can have folks that have sustained psychosis, so they've had maybe a long history of synthetic marijuana use, and now they have developed a permanent psychotic disorder. So it can vary, and there's really no way to know how it may impact somebody. If somebody has a family history already, that may predispose them to having maybe a more sustained psychotic disorder after the use of substances. So the next category that I'm going to discuss are mood disorders. And so like the name implies, obviously these are disorders where an individual has difficulty regulating their mood, regulating their emotions. And so there's two kind of subcategories that fall under mood disorders. So the first is major depressive disorder, which like the name implies is obviously somebody who is experiencing a significant episode of depression. And I'll talk a little bit more about that in a moment. And then we have bipolar disorders that also fall under this category. And these are individuals who are experiencing kind of extremes of emotions or mood. So they may experience periods of depression, and then alternatively, they may experience periods of euphoria and elation, so very elevated mood. And then in between those two episodes, they may have kind of more baseline neutral mood. And then of course, substances and medications, again, can also induce some bipolar symptoms or even some depressive symptoms in individuals. So depression, I feel like most people are pretty familiar with what depression looks like, but there may be some signs or symptoms on here that may be new. So obviously experiencing a persistently sad or empty mood. Folks that have major depressive disorder may also be very anxious. They could even be a bit irritable. Feelings of hopelessness, guilt, worthlessness, helplessness are all very common. Individuals experiencing a major depressive disorder may have a loss of interest in hobbies or activities. They may experience fatigue, loss of energy. They may move or talk much more slowly, much more belabored in their speech. They can experience sleep disturbance, and that can look like either sleeping too much or having insomnia and not being able to sleep. They may experience difficulty with concentration, remembering, making decisions, focusing. They can feel very restless. Appetite changes and weight changes are common, again, in both directions. People can be eating more than normal or less than normal. Aches, pains, kind of general, bodily issues can happen. And of course, most seriously, folks experiencing major depression could have thoughts of suicide or actually make suicide attempts. So those symptoms obviously are going to relate to a diagnosis of major depressive disorder. When we have somebody that has a bipolar disorder, like I mentioned, these folks are going to experience periods of depressed mood, but also periods of what we call mania. So this is a time, I like to explain it to folks as the opposite of depression, feeling very up, very elated. Sometimes folks will describe themselves as feeling euphoric, on top of the world. You could also feel very agitated or even during this period. People experiencing mania may also have inflated sense of self-esteem or even grandiosity, like I talked about a few minutes ago. So they may think that they're very special, very important, people want to be around them. It could go as far as being a delusion where they are a celebrity or they're a famous person in the community. A major feature is decreased need for sleep. So when folks are in this mood state, they often may not sleep for 2, 3, 5 days, or they may sleep very little and still have plenty of energy. They feel rested, they feel fine. They're engaging in a lot of different activities, kind of on the go, kind of like the Energizer Bunny. They may be more talkative than usual. They may speak very quickly. Sometimes people may have trouble understanding what they're saying because they're talking so fast. They may also experience racing thoughts, which kind of ties in with that racing speech. Just their thoughts are moving so quickly in their head. They have so many ideas. They can't kind of get them all out at once. They can be very easily distracted, and they can also engage in very risky behaviors during this period of time. So it's very common to see people maxing out their credit cards, shopping, or gambling their life savings, or going out and having sexual relations with multiple people in a day or in a week. Driving, 150 miles an hour on the freeway, things that they wouldn't normally do, but now are feeling a little bit less inhibited and engage in very risky behaviors. So when we think about, before I go into substance use, when we think about bipolar disorder, like I mentioned, these are people that are going to experience these poles, right? These extreme mood states. And somebody may only ever have one manic episode in their life, and then they may kind of have a neutral mood and then dip into periods of depression. There may be people that experience multiple manic episodes and maybe less depressive episodes. Generally speaking, people move through these phases and it takes time. So it may be a period of weeks, likely months, where people are moving between these mood states. It's not somebody that's kind of vacillating up and down in the course of a day or 2 days. It generally takes a little bit more time to kind of cycle through these mood states. And then, of course, substances can also alter folks' mood states. So mania can be induced by stimulants. That makes sense, like cocaine, amphetamine, kind of ramp people up, just like a manic episode would. PCP, steroids, again, synthetic substances like synthetic marijuana or bath salts. Other medications can induce depression. So some stimulants, especially on the withdrawal, if somebody's withdrawing from cocaine, for example, they may experience some depression. I don't have it on here, but alcohol is a depressant. A lot of prescribed medications can induce some depressive symptoms. And like I said, usually when we have somebody who may be withdrawing from a certain substance, they may experience depression. And unfortunately, we commonly see, like I mentioned earlier, substance use in conjunction with serious mental illness. So sometimes folks with bipolar disorder who already experience periods of mania may also be abusing stimulants that kind of mimic that. Those periods can be very enjoyable for people because they have a lot of energy and they're feeling great, so they may want to try to prolong some of those symptoms, and so they may turn to stimulants in order to do that. So post-traumatic stress disorder, that's another disorder that I just wanted to cover briefly. So I think most commonly when we think about PTSD, we think about combat veterans, but PTSD can be diagnosed for a variety of different experiences. So in order to have this diagnosis assigned, you have to have exposure to an actual traumatic event or a threatened traumatic event. In certain cases, people can even be diagnosed if they've, learned or talked about a trauma that somebody else experienced, but they experienced it very vividly themselves. So again, we think about combat veterans, but children who have been physically or sexually abused, somebody who's been robbed at gunpoint, somebody who's been through a serious natural disaster. Any one of these situations could potentially result in a diagnosis of PTSD. So when we have an individual who's experiencing PTSD, there is usually some re-experiencing of the event or intrusive thoughts about the event. So these are not in the context of somebody's thinking or talking about the event and they start to have memories. These come out of nowhere, they're very intrusive, and they just kind of pop up out of the blue. Folks with PTSD can tend to avoid reminders of the event. So say somebody was robbed at gunpoint at their local bank, they may avoid going to that bank. They may change banks altogether so they don't even have to see the logo of the place where they got robbed. Or if somebody was physically abused as a child, they may avoid their childhood home at all costs in order to not kind of re-experience some of those feelings. They can have disturbance in their thinking, in their mood. You may see irritability, depression, things like that. Frequent nightmares, again, those intrusive thoughts about the event. And they may have the tendency to startle easily, or maybe what we call hypervigilant, so kind of always on alert, always looking for the threat in the environment. We think about, again, really commonly with our combat veterans, 4th of July or New Year's, and how sometimes they can be very easily triggered by the sounds of fireworks because it sounds like gunfire. I mean, that can be applied to any sort of trauma that somebody experienced where they could be triggered, or just constantly on edge, constantly on high alert. Folks with PTSD can also have difficulty regulating their emotions. So they may have difficulty kind of managing when they feel angry or feel upset by something. And they can also have difficulty maintaining their interpersonal relationships with people because of the trauma that they have experienced. So that's how this fits in terms of those, really severe impairments in somebody's day-to-day functioning. PTSD can most definitely inhibit somebody from engaging in their day-to-day lives. And then finally, I just wanted to briefly cover developmental disabilities. So again, these are not considered serious mental illnesses, but these are conditions, lifelong conditions that can interfere with somebody's capacity to do their day-to-day functioning or live independently. And so sometimes folks with these conditions may need additional assistance. So the first developmental disability is intellectual developmental disorder, or IDD. In years past, we used to refer to this as mental retardation. We don't use that terminology anymore. Intellectual disability or IDD are the terms that we now use. And so just like the name implies, this obviously refers to deficits in intellectual functioning. So somebody's, ability to problem solve, process information, understand, communication, things like that. And also their adaptive functioning. So that just means their ability to perform, daily tasks like maintaining their hygiene, preparing meals for themselves, managing money, transportation, things like that. So when we're assigning a diagnosis of IDD, we're looking at a broad range of domains and capacities that somebody can have. So in years past, we used to just think about, well, we would give somebody an IQ test, right? A standard test to measure their IQ down to a number. And we used to say, okay, they have this number, so that means that they are IDD. Now we look at that information, but also how they're functioning in various different domains. So their conceptual domain, so that basically refers back to, their ability to problem solve, a lot of academic functioning, reading, writing, those types of skills. But also we're looking at their practical domain. So the day-to-day tasks, again, can they manage money? Can they have a bank account? Can they go into a store and make a purchase by themselves? And their social domain. Are they able to interact in an age-appropriate way with other individuals? Are they able to gauge perceived threats or dangerousness? Are they easily taken advantage of by people? So we're looking at a wide variety of different areas when we're assigning this type of diagnosis. And the thing with intellectual disability is that we have to see this in the developmental period. So before somebody is 18 years of age to make a diagnosis. This is not something in most cases that's going to come out of nowhere. This is typically going to develop, when we're going to see signs early in childhood. There are times when people may suffer a brain injury, and then as a result, then they may have some deficits because of that. But outside of something like that happening, this is something that we will start to see even in young children, kind of some of these areas where we're seeing some deficits. The other developmental disability that I wanted to talk about was autism spectrum disorder. So this is a disorder, and like the name implies, it's on a spectrum. So we can see people at varying levels of functioning. Same thing with IDD as well. Folks with autism spectrum disorder tend to have difficulties with communication, behavioral control, difficulties in appropriate social interactions with other people. So they may, in some serious cases, not be able to verbally communicate at all. So they have no verbal language. They may have limited verbal language. They may have difficulty following social cues in a conversation or in a social setting. We may see restricted interests and repetitive behavior, especially in children. If we have a child that's very fixated on like dinosaurs, right? They may solely focus on that, and everything in their life revolves around that, and they know everything about dinosaurs, and everything revolves around that. So it's very limited fixed interests. We also may see repetitive behaviors like moving their hands or like playing with their hair, things like that, kind of stereotyped behavior. And these difficulties are going to impact their ability to function various life areas. And individuals with autism spectrum disorder may have intellectual deficits in addition, and others may not. They may have perfectly, adequate IQ skills, but their social abilities and their communication abilities maybe are a little bit more impaired. And like I mentioned, this is on a spectrum, so there's a wide variety in terms of like the severity and the impact that symptoms may have. I feel like some folks are familiar with the diagnosis of Asperger's disorder. That used to be an old term that we used for somebody who had an autism spectrum disorder and was more high functioning. We don't use that term anymore. Now it's just all under the umbrella of autism spectrum disorder. So that's a very brief overview of a lot of serious mental health conditions. So now what I wanted to do was talk about ways in which we can assist friends, loved ones, people in our community who may need access to mental health services because of a serious mental illness that they might have. So a mental health warrant is one way in which a loved one or a friend or a family member, community member perhaps, could assist somebody in getting connected to mental health services. So this is to be used in a situation where somebody is in immediate crisis. Somebody is a danger to themselves, somebody is a danger to others, somebody is unable to care for their daily needs in a very significant manner. It is not a warrant for arrest. Law enforcement is involved in the process, and they are there to just basically facilitate getting somebody to a psychiatric facility. Now, this is to be used in a case where somebody will not voluntarily go. You may have a friend or loved one who you can see they're in crisis and they will say, yes, I know I need to go to the hospital, and they can voluntarily admit themselves. But if we have somebody who cannot do that, then this is something that may potentially have to be considered. So what it does is it orders somebody to undergo a mental health evaluation by a physician to determine if they require inpatient hospitalization. And the reason this is such a, complex process is that you're basically taking away somebody's rights and saying, we need to take you out of the community and put you in a hospital setting for your safety. So in order to get a mental health warrant here in Fort Bend County, the proposed patient, the individual who may be in crisis, needs to either reside here or be in the county at the moment when this is trying to be executed. And there has to be current information that the person is immediately going to be a danger to themselves. So they may be suicidal or a danger to others, where they may have been made threats of homicide or threats of harm to somebody else. This cannot be something that happened a week or two ago. It has to we have to show that the person is in immediate danger. So their past behavior will not qualify. We cannot get a mental health warrant just to say, oh, well, my loved one has schizophrenia and they need to go to the hospital. We have to be able to show that there's a crisis, a critical need. And this generally cannot be done if the person is in jail. The jail does monitor folks very closely, and if somebody does need inpatient hospitalization, there are ways to do that, but this is for folks that are in the community. So there's kind of two different ways to go about this. If somebody has insurance, if you have a friend or a loved one that you feel like needs to get hospitalized and they have insurance, then you could go ahead and contact a local psychiatric facility, which I will have those listed on a later slide, and determine if they will take the insurance that the proposed patient has, and if they have a bed available for that individual. If you are able to find some place, then it would be important to get down that information because it will be needed later for the actual mental health warrant application. But it's important to keep in mind that if the facility is in Harris County, which the overwhelming majority of our inpatient facilities are, this would have to be filed in Harris County in most circumstances and not in Fort Bend County, but that would obviously be something to be discussed when the warrant is being filed. If the person has no insurance, they are uninsured, a lot of facilities do have indigent beds, so they do have space where they can admit some folks that don't have any insurance. So you would need to call a facility and find out about the availability of an indigent bed for that person. If there's no private facility that will take the individual, Texana Center, our local mental health authority here in Fort Bend County, could be contacted. They do have a crisis center, and there may be possibility of getting somebody admitted to that facility if there is space. If a state hospital, for example, Austin State Hospital, is the only facility that has availability, which these days I would be very surprised if that was the case, then those proceedings and that mental health warrant would have to be done out in Travis County or wherever that hospital is located. So important things to keep in mind. Sometimes things may need to be done in different jurisdictions, just depending on where the facility is located. So in order to file for a mental health warrant, somebody needs to get in contact with the justice of the peace in their jurisdiction. And just looking at this right now, I know that we had a big change in all the districts recently. So some of this information may actually be reflective of kind of old jurisdictions, but you would need to contact justice of the peace where the individual is. And then you'll have to complete an application for a mental health warrant. So if you contact the court, they would be able to advise you in terms of how to access that information. If you have a bed pending for somebody, you've been able to some place for them, then that information will be needed on that application to show a place that's willing to evaluate my loved one or my friend or whoever and see if they meet criteria to be admitted. Now, this obviously is only going to be happening during, Monday through Friday during business hours. So if it's after hours or it's the weekend, then there's the option to contact the sheriff's office dispatch and let them know that you need to contact the justice of the peace on call regarding a mental health warrant. And somebody should be on call to assist with that after hours. So once all of that procedure is done and the application is done, if the mental health warrant is then issued by the judge, it will be sent to either the sheriff's office or to Texana Center in order for them to then make contact with the individual in the community and transport them to the facility where the bed is waiting for them. Again, it is not an arrest. This person is not being taken into custody. The sheriff's office can just assist in facilitating the transportation to get them where they need to go. And this website has a lot of information. If you do have to file a mental health warrant for somebody, about the process and how to go about it. So that's one option in terms of how do we assist people that are in our community and are in crisis. Another option here in Fort Bend County is the Sheriff's Office Crisis Intervention Team, or CIT. This is a specialized unit within the Sheriff's Office that assists in individuals who are suffering from mental illness. So they are available to assist folks when they are in crisis. So that can be just a crisis, a mental health crisis. Somebody may be suicidal. CIT can be contacted. They can, make contact with the individual, do an evaluation, and then if we need to get Texana Center involved and their crisis evaluators out there, they can facilitate in getting that person out there to hopefully get the individual to a hospital where they can be further evaluated. CIT sometimes is also involved when maybe somebody's in crisis and there may have also been some type of criminal activity that's been alleged, maybe an assault of a family member or something along those lines. CIT is there to assist and potentially divert that person, maybe temporarily at least, out of the jail system and into psychiatric care if that's what's necessary at the moment. So keeping them out of the jail for the time being, or even out of our emergency rooms where sometimes folks end up when they're in crisis, they can assist in getting them to a psychiatric facility so our ERs can stay open for medical emergencies. These officers are specially trained in de-escalating, diverting folks, and working with individuals who are in crisis and working with their families. CIT also provides a lot of training to other first responders, so other law enforcement agencies, dispatch, EMS. They provide a lot of training. I'm actually doing part of their training tomorrow, to other law enforcement agencies so that everybody across the county hopefully will be trained in de-escalating situations, in how to engage with individuals who may be in crisis, individuals with serious mental illnesses. Texana Center, they are the local mental health authority for Fort Bend County and a variety of other neighboring counties as well, 6 counties in total. They provide services regardless of insurance or citizenship status to people. So they provide behavioral health care services. They also provide a variety of services for folks that may have IDD or autism spectrum disorder. They're kind of 2 separate divisions within Texana Center, so they can serve a wide patient base. As I mentioned earlier with CIT, Texana has its own crisis center. They also have a mobile crisis unit so that if they need to come out to assess somebody who may be suicidal or maybe homicidal, they can be contacted directly. Somebody can come out and assess and then potentially facilitate that person getting into a psychiatric facility for further evaluation. They may also come out and assist our CIT deputies as well if there is a crisis. So for our veterans, because we were talking about PTSD, there is a program locally in the area called the Xena Project, and they work with veterans and all veterans, so they don't have to have any sort of disability status. They could be in any of their career, so active, reserve, a veteran. They can served in any era, any time period, and they provide a variety of counseling and support services to those individuals. And obviously, like we talked about, PTSD could be prevalent in that population, so they can provide individual services, family services, even animal encounter therapy, which is shown to be really effective in working with individuals with PTSD. So their contact information is down here. Now, this is obviously for somebody who's not an immediate crisis, but somebody that may be a veteran and needs ongoing support or wants to get connected to a community of veterans to build, that support network, which is very important in terms of, healing and kind of moving forward past some of the experiences that they may have had. I briefly just wanted to talk about different types of mental health providers that are out there when we're thinking about folks with serious mental illness. They may touch a lot of different folks in the mental health field, and sometimes people get very confused. Who's who and who does what. So I just wanted to provide kind of a very brief overview. And individuals, especially those with serious mental illness, may have a team of varying providers. So multiple people that may be working with them in terms of managing their case and managing their illness. So a psychiatrist is a type of mental health professional that holds a medical degree. So they are a medical doctor. Primarily, their focus is on evaluating an individual for treatment, so for medications, prescribing medications, managing medications, adjusting medications as needed. Sometimes they do, work and provide some counseling type services or supportive type services. Predominantly, they are there for that medication piece since they are physicians. And they're an important piece of the treatment, especially for folks with serious mental illness, where medication is often needed as part of the treatment regimen for somebody. Then we have a psychologist. So that is somebody with a doctoral degree, either a PhD or a PsyD. These are both doctoral level degrees in psychology. And psychologists can provide counseling services and also play a big role in psychological evaluation. So they may be evaluating somebody prior to them meeting with a psychiatrist to determine diagnosis. In the court system and the work that I do, I'm an evaluator, evaluating defendants with serious mental illness. And so that's the role that psychologists can play kind of in both areas. And then we have professional counselors. So these individuals hold a master's degree. They can also hold a doctorate as well. And their area of expertise and their primary focus is in the delivery of counseling services. So actually working with individuals, families, couples, whatever the case may be, in providing that individual therapy. So they are an important piece of the process because they are very focused and well-trained in the area of counseling. So no matter what type of provider you may be looking for, it's important to make sure that whoever you're selecting, whether it's for yourself or for a loved one, has the appropriate license, that they're a licensed psychiatrist or psychologist or licensed professional counselor. And like I said, we may have somebody that has a team of people. So somebody with a very serious mental illness may have a psychiatrist, they may have a counselor, they may have a case manager, they may have a vocational counselor. So there might be a lot of different people working to provide them the services and the supports that they need. In terms of accessing private providers, so we talked about Texana as our community mental health provider, but if somebody has insurance and is able to access a private provider, there's a lot of different places where people can go in order to see the clinicians in the area. So obviously going to, directly to the insurance that person has would be a great resource. And there's also places like the Texas Psychological Association to search for psychologists, or the Texas Counseling Association to search for licensed professional counselors, the Houston Psychological Association. There's also a Fort Bend Psychological Association, or psychologytoday.com. That's a great website with a vast database of providers. And then what you can do is search for providers that will meet your needs or the needs of the individual that you're trying to assist. So if for some reason your client maybe needs a female therapist, you can search for female therapist. If you need somebody that speaks a particular language, you can search for that, or people that work with particular disorders or specialize in certain areas, so you can really focus to help find the best provider. And I think the thing that sometimes people don't think about in terms of working with mental health providers, everybody is not always a great fit, right? So somebody really needs to find the provider that they feel comfortable with, especially when we're talking about counseling, somebody that they feel that they can trust and they can open up to. And it may take a couple of times to find the right provider if you're searching privately for somebody that you or your loved one really connects with, because that's where the best work is going to happen. So it may be a trial and error type of process. So just briefly, this is a list, and it's not an exhaustive list, of local psychiatric hospitals. Some are state hospitals. I've outlined those. The others are local private facilities. Unfortunately, we only have one here in Fort Bend County. That's here. The rest are all in Harris County, but obviously here, Fort Bend County residents are able to go as long as there's a bed there and they're able to take them. And so this is not exhaustive, but it's kind of a good comprehensive list. And if you have somebody in your life, a friend, a family member that have a serious mental illness, this may be a good resource to have on hand in case the need ever arises for them to either voluntarily or involuntarily go to the hospital. It's a good resource to have close by. Additionally, here are some crisis resources. So I've talked about a lot of these already in the presentation. Texana has their own dedicated crisis line, again, for anybody in Fort Bend or any of those other counties, neighboring counties that they serve. CIT. So the best way to get in contact with CIT is to call the sheriff's dispatch and ask for CIT. Let them know you're with somebody that's having a mental health crisis, you need CIT. If it is an emergency, though, if you are in a critical situation where there's, threat of serious injury, 911 is the best place to contact. And you could always tell them, the individual here has a mental health condition, they're in crisis, if I can get CIT, but make sure that, if you need emergency services, you're calling emergency services. If somebody needs services in Harris County, the Harris Center is a community mental health provider there, and they have their own crisis line. You need to call the number that's on the screen and press 1 to access their crisis services. There's also several Memorial Hermann mental health crisis clinics. Unfortunately, none of them are here in Fort Bend County, but if somebody lives in any of these other areas and is in need of crisis services, maybe they ran out of their prescription of medication and it's the weekend and they can't, get in to see their doctor, perhaps one of these walk-in clinics would be able to assist. So they have one general number for their those clinics. There's also a veterans crisis line. Again, if we have a veteran who would prefer to speak to somebody who understands their needs best, the number is here. There's also a text number that they can text to. And then the National Suicide Prevention Lifeline, also, a crisis resource on a national level that then may be able to direct services. But now you guys are well aware of the crisis services that we have available here locally and can contact them directly if needed. And then just a few other mental health resources. So Fort Bend County Behavioral Health Services, like Dr. Almeida mentioned, we work with individuals who are involved in our court systems, our criminal courts, juvenile, family courts. But if you ever had questions or needed some resources provided, you are more than welcome to call our number. And if we're not able to directly assist, we can help connect you to some place that can in the community. Again, Texana Center, their regular number, not their crisis number. Access Health, they are the local provider here in Fort Bend County for medical services for folks who may be uninsured or underinsured, but they also have behavioral health services as well. Their contact is there. And the Harris Center, also the Veterans Administration, so the DeBakey VA downtown and also the Richmond VA, their contact information for our vets. NAMI, the National Alliance of Mental Illness, they're an agency that provides a lot of supportive services and family supports. They can be a great resource for information. Their number is there, and then 2 contacts for just local agencies that assist with substance abuse treatment. There's a lot of different private facilities out there, but these are also 2 great agencies to contact if there's a need for that. And then lastly, just again, our number at Behavioral Health Services, that's our main number. If you have any questions about what we provide or need assistance getting in contact with anybody for services for yourself, your friends, or your loved ones. And then we have about 2 or so minutes left for questions, if there are any questions from folks in the room, or if there was anything that came through on the chat. Just checking right now if there's anything on the chat. Well, if there are any questions, feel free to contact us at BHS, and if I can answer any questions directly, I'd be happy to do so. Thank you all so much for tuning in, and we have plenty of other presentations throughout the month, so thank you all so much.
Good job.
Thank you.